What is a Cushing's crisis in dogs, and what are the symptoms? Have you ever wondered what happens when a dog with Cushing's disease faces a sudden health crisis? Understanding this can help you keep your furry friend safe. Cushing's disease, also known as hyperadrenocorticism, occurs when a dog's body produces too much cortisol. This hormone plays a role in managing stress, metabolism, and immune function. While Cushing's disease is a chronic condition, a Cushing's crisis is a serious complication that can arise if the disease is not managed properly. Cushing's disease is often caused by a benign tumor in the pituitary gland or on the adrenal glands. It can also result from long-term use of steroid medications. The excess cortisol disrupts normal body functions, leading to symptoms like increased thirst and urination, increased appetite, a pot-bellied appearance, hair loss, and lethargy. These signs develop gradually and can affect a dog's overall health. Now, a Cushing's crisis is different. It is an acute medical emergency that can happen when the hormonal imbalance becomes severe. This can occur if a dog with untreated Cushing's disease experiences extreme stress, an infection, or another illness. Additionally, stopping steroid medications suddenly in a dog with iatrogenic Cushing's can trigger a crisis. The symptoms of a Cushing's crisis are much more severe than those of chronic Cushing's disease. You may notice extreme weakness or even collapse, severe dehydration, vomiting, diarrhea, disorientation, seizures, or shock. These signs indicate that multiple organ systems may be failing, and immediate veterinary care is essential. Diagnosing Cushing's disease involves a thorough physical examination, a detailed history, blood tests to measure cortisol levels, and imaging studies like ultrasound or magnetic resonance imaging to identify tumors. Differentiating between chronic Cushing's disease and a crisis is based on the severity and rapid onset of symptoms. Treatment for chronic Cushing's disease may include medication to control cortisol production or surgery to remove a tumor. Regular monitoring is necessary to manage the condition effectively. In contrast, a Cushing's crisis requires emergency treatment, including intravenous fluids, medications to stabilize blood pressure and blood sugar, and addressing the underlying cause of the crisis. As a pet owner, it is vital to recognize the early signs of Cushing's disease and seek veterinary advice promptly. Regular checkups are essential, especially for dogs on long-term steroid therapy or those diagnosed with Cushing's. If your dog shows sudden severe illness, particularly if they have a history of Cushing's symptoms, seek emergency veterinary care immediately. Understanding the signs and knowing when to act can make a significant difference in your dog's health and well-being.